The passage of food through the esophagus. The upper esophageal sphincter, which is continuous with the inferior pharyngeal constrictor, controls the movement of food from the pharynx into the esophagus. The upper 2/3 of the esophagus consist of both smooth and skeletal muscle fibers, with the later fading out in the bottom third of the esophagus. Rhythmic waves of peristalsis, which begin in the upper esophagus, propel the bolus of food toward the stomach. Meanwhile, secretions from the esophageal mucosa lubricate the esophagus and food. Food passes from the esophagus into the stomach at the lower esophageal sphincter, also called the gastroesophageal or cardiac sphincter. Recall that sphincters are muscles that surround tubes and serve as valves, closing the tube when the sphincters contract and opening it when they relax. Stomach. There are 4 main regions in the stomach: the cardia, fundus, body, and pylorus. The cardia, or cardiac region, is the point where the esophagus connects to the stomach and through which food passes into the stomach. Located inferior to the diaphragm, above and to the left of the cardia, is the dome-shaped fundus. Below the fundus is the body, the main part of the stomach. The funnel-shaped pylorus connects the stomach to the duodenum. The wider end of the funnel, the pyloric antrum, connects to the body of the stomach. The narrower end is called the pyloric canal, which connects to the duodenum. The small muscle pyloric sphincter is located at this later point of connection and controls stomach emptying. In the absence of food, the stomach deflates inward and its mucosa and submucosa fall into a large fold called a rugae. The convex lateral surface of the stomach is called the greater curvature. The concave medial border is called the lesser curvature. The stomach is held in place by the lesser omentum, which extends from the liver to the lesser curvature, and the greater omentum, which runs from the greater curvature to the posterior abdominal wall. The body absorbs 90% of its nutrients through the small intestine into your blood. The small intestines. Chyme, released from the stomach, enters the small intestine, which is the primary digestive organ in the body. Not only is this where most digestion occurs, it is also where practically all absorption occurs. The longest part of the alimentary canal, the small intestine, is about 3 meters or 10 feet long in a living person. Since this makes it about 5 times longer than the large intestine, you might wonder why it is called small. In fact, its name derives from its relatively smaller diameter of only about 1 inch compared with 3 inches or 2.54 centimeters compared with 7.62 centimeters for the large intestine. In addition to its length, the folds and projections of the lining of the small intestine work to give it an enormous surface area, which is approximately 200 meters square, more than 100 times the surface area of your skin. This large surface area is necessary for complex processes of digestion and absorption that occur within it. The coiled tube of the small intestine is subdivided into 3 regions. From proximal, at the stomach, to distal, these are the duodenum, jejunum, and ileum. Large intestines. The large intestine is the terminal part of the alimentary canal. The primary function of this organ is to finish absorption of nutrients and water, synthesize certain vitamins, form feces, and eliminate feces from the body. The large intestine runs from the appendix to the anus. It frames the small intestine on 3 sides. Despite its being about 1/2 as long as the small intestine, it is called large because it is more than twice the diameter of the small intestine, about 3 inches. The large intestine is subdivided into 4 main regions: the cecum, the colon, the rectum, and the anus. The Ilioceal valve, located at the opening between the ileum and the large intestine, controls the flow of chyme from the small intestine to the large intestine. The first part of the large intestine is the cecum, a sac-like structure that is suspended inferior to the ilioceal valve. It is about 6 centimeters or 2.4 inches long, receives the contents of the ileum, and continues the absorption of water and salts. The appendix, or vermiform appendix, is a winding tube that attaches to the cecum. Although the 7.6 centimeters or 3-inch long appendix contains lymphoid tissue, suggesting an immunologic function, this organ is generally considered vestigial. However, at least one recent report assumes the survival advantage conferred by the appendix. In diarrheal illness, the appendix may serve as a bacteria reservoir to repopulate the enteric bacteria for those surviving the initial phases of the illness. Moreover, its twisted anatomy provides a haven for the accumulation and multiplication of enteric bacteria. The Meso Appendix, the mesentery of the appendix, tethers it to the mesentery of the ileum. The cecum. The first part of the large intestine is the cecum, a sac-like structure that is suspended inferior to the ilioceal valve. It is about 6 centimeters or 2.4 inches long, receives the contents of the ileum, and continues the absorption of water and salts. The appendix, or vermiform appendix, is a winding tube that attaches to the cecum. The Meso Appendix, the mesentery of the appendix, tethers it to the mesentery of the ileum. Colon. The cecum blends seamlessly with the colon. Upon entering the colon, the food residue first travels up the ascending colon on the right side of the abdomen. At the inferior surface of the liver, the colon bends to form the right colic flexure, or hepatic flexure, and becomes the transverse colon. The region defined as hindgut begins with the last third of the transverse colon and continues on. Food residue passing through the transverse colon travels across to the left side of the abdomen, where the colon angles sharply immediately inferior to the spleen at the left colic flexure, or splenic flexure. From there, food residue passes through the descending colon, which runs down the left side of the posterior abdominal wall. After entering the pelvis inferiorly, it becomes the S-shaped sigmoid colon, which extends medially to the midline. The ascending and descending colon and the rectum are located in the retroperitoneum. The transverse and sigmoid colon are tethered to the posterior abdominal wall by the mesocolon.